Good day, nurses and friends. Today we're going to talk about the number 4 and number 5 of the NCLEX RN test-taking strategies. Today I will be combining the number 4 and number 5 because the number 4 is pretty short. We can start by number 4, giving yourself plenty of time to study and be confident. Be confident as well as planning. As we all know, planning and preparation to do an exam like this, which is a major exam, is important to make sure that you have all the knowledge and the bullets, to go into war, as well as familiarize yourself with. For example, if you're weak in maternal and child nursing, you want to focus on that. And if you have any other subject matter that needs to be redefined or reviewed, it is very imperative that you focus your time on those ones, on those topics, as well as self-care and de-stress. Self-care meaning, for others, it might be listening to music, relaxing, getting a massage. It might be meditation. It might be singing or listening to music, as well as even talking to friends, as well. And if the subject matter or the whole exam itself is overwhelming because of too many things that you need to study, make sure to make it into small chunks. Don't be stressed out, and give it time. The number 5 strategy would be don't pass the buck. Don't pass the buck. That means do not give the job to another people where you are supposed to implement something, or you're supposed to react to something or to do something as a nursing responsibility. You instead is giving it to another discipline. It might be a pharmacist, it might be a doctor, or it might be a nursing attendant, when in fact it should be your responsibility. Now, to give this an example, this multiple choice: a child has an allergic reaction to penicillin, an antibiotic, and was admitted to the hospital 2 weeks ago. The client is being seen at a clinic for a follow-up visit. Which priority intervention should the nurse implement? So the first one would be the perfect example for passing the buck. Encourage the client to tell the pharmacy about the allergy. It's not the pharmacy's responsibility to talk about allergy, but rather it's the nurse's responsibility, actually. And besides, what does that have to do with the allergy with the pharmacy? It's your responsibility as a nurse. While the third option, tell the client not to be around any person taking penicillin, it's irrelevant because penicillin is not contagious. Penicillin is a medication for infection, right? Now, to go back to the allergic reaction, what are the symptoms of allergic reaction? That would be, the early symptoms would be hives, swelling. There might be itchiness, while the late symptoms of allergic reactions would be very low blood pressure or hypotension, dyspnea, abdominal pain, swelling of the throat or tongue, or diarrhea or vomiting. Now, going to the fourth option, allow the client to ventilate feelings about the hospitalization. As you can tell, as you go back to the question, sometimes the answer is in the question, right? The client has been discharged from the hospital and has been seen in the clinic. So it's kind of too late to ask him about his feelings about hospitalization, since he's already out of the hospital. So number 4 is irrelevant and not important. So in the U.S., wearing the medical alert bracelet is highly recommended. They're very big on that one. Wearing something, it might be telling, the bracelet might say you're allergic to penicillin. It might say you have a seizure precaution. It might say you have a pacemaker inside you. Those are things that are that can be put on the medical alert bracelet. It could be the medication that you're allergic to, like penicillin, at this particular example. Okay, so next one would be this would be another example, right? Robert, a 57-year-old client with acute arterial occlusion of the left leg, undergoes an emergency embolectomy. 6 hours later, The nurse is not able to obtain pulses in his left foot. Using Doppler ultrasound, the nurse immediately notifies the physician and asks her to prepare the client for surgery. As the nurse enters the room to prepare him, he states that he won't have any more surgery. Which of the following is the best initial response by the nurse? Now, going through the option, since the patient is already, the second option would be notifying the physician immediately. That would be passing the box, as well as notifying the nursing supervisor. Now, recording the client's refusal in the nurse's notes is, well, if the number one is not successful, then you can do that. But initially, as a nurse's responsibility, you can explain the risk of not having the surgery. Now, the specific detail of the surgery, and getting the consent of the patient would be the responsibility of the surgeon, not the nurse. But explaining the risk of not having the surgery would be the perfect answer, would be the correct answer in this situation. Okay, that's about it for today. Have a nice day.